All right, everybody, get ready, because today we are taking a deep dive into the world of really big prostates.
Really
I
big.
mean, like over 200 cc and a procedure called HOLIP.
Holmium laser enucleation of the prostate.
Yeah, that's it. And we'll be looking at a 2024 research article from BJY Compass. But what makes this deep dive really interesting is,
The trainees.
yeah, the trainees are involved in this.
Exactly. This study looks at trainees in an academic setting doing these procedures, which
Yeah, that's a unique perspective.
is.
So before we get into the study, could you give us a quick overview of what HOLEP is and why it might be good for these very large prostates?
Sure. Imagine using a laser to carefully remove the enlarged portion of the prostate, almost like peeling an orange.
Okay.
That's the essence of HOLEP. Now, what's really interesting is that unlike some other prostate procedures, HOLEP is generally considered size independent.
Okay, so
This means that even with a prostate over 200 cc, the laser can still effectively remove the enlarged tissue.
it's more precise,
More precise.
maybe more thorough than some other techniques,
Potentially, yes.
which seems like a big win for patients with these very large prostates. But why are they considered a special case in the first place?
Well, they're more challenging from a surgical perspective.
Why is that?
Think of it like navigating through a dense forest. The larger the forest, the harder it is to see and move around.
Okay.
Similarly, for surgeons, very large prostates can obscure those important anatomical landmarks, making the procedure more technically demanding.
I see.
They also tend to have increased vascularity, meaning there's a higher risk of bleeding during the surgery.
Oh, so that's another hurdle.
It is, and even removing the enucleated adenoma,
That's
that's the removed prostate tissue,
got it.
that can be trickier. It's like trying to get a large object through a small doorway.
Right, so it's the limited visibility and increased bleeding risk and just the size.
It all adds complexity.
Got it. That's why the study is so important. It sheds light on a procedure that's becoming more and more relevant.
Absolutely, especially as the prevalence of BPH continues to rise.
Now, you mentioned that this study involves trainee surgeons.
Yes,
I imagine some people might be a little hesitant about that.
I understand that concern, but training future surgeons is crucial.
Of course.
And it's done in a very structured manner.
Okay.
In our academic setting, we have what's called a graduated responsibility model,
Uh-huh.
where trainees slowly progress as they gain experience.
So it's not like they're just thrown into the operating room
No, not at all. There's always mentorship and oversight.
to ensure patient safety.
Exactly.
Okay, good. And this study actually provides some reassuring data on the safety of this.
It does.
What were some of the key findings that stood out to you?
Well, the results are really quite compelling. They analyzed 89 cases of en bloc HULEP,
Right.
which is a technique where the entire prostate adenoma is removed in one piece.
Got it.
Now, despite the trainee involvement, the complication rates were very low,
Wow.
comparable to those of experienced surgeons.
So in terms of safety, it seems like the trainees were performing well.
Very
But what about just the technical aspects of the surgery? Did the trainees being involved affect things like operative time?
well, the median operative time was longer than you might see with a very experienced surgeon,
Right.
but that's to be expected.
They're still learning.
Exactly. It's a learning curve. And it's important to remember that even though the operative time might be a little bit longer, the outcomes were excellent.
That's good.
Patients had significant improvement in things like urinary frequency and urgency.
So their quality of life improved.
Exactly. And we also saw improvements in those objective measures we talked about earlier, IPSS, PVR, and QMAX,
Right.
all important indicators of prostate health.
Yeah. Sounds like they're measuring all the right things.
Absolutely. And at 3 months post-surgery, they had a very low median PSA level
Okay.
and very high continence rates.
So no long-term negative outcomes.
Not at all. It highlights that surgical time isn't the only factor.
Now, you mentioned en bloc a few times.
Yes.
And the adenoma being removed as one piece.
Yes.
Is that different from the standard HOLEP procedure?
It is a variation. In traditional HOLEP, the adenoma is often morcellated, meaning it's broken down into smaller pieces inside the bladder and then removed.
Okay.
But this unblock approach is gaining popularity,
I see.
especially for larger prostates.
So it's like opting for a whole apple instead of apple slices.
Uh-huh, exactly. And this study looks specifically at the unblock technique.
Adding another layer of complexity.
It does.
It's impressive that they got such positive outcomes.
It really is. It speaks to the quality of the training.
And the skill of the surgeons.
Yes, definitely.
Now, what might someone be thinking or feeling if they were told that a trainee would be involved in their procedure?
Well, I think it's understandable for patients to have some questions,
Of course.
maybe some concerns about the level of experience.
So would you say that it's crucial for doctors to be upfront with their patients about this?
Absolutely. Open communication is essential.
And that helps to build trust, I would imagine.
It does. It creates that partnership between the patient and the medical team.
Now, before we move on, there was one more detail in the study that I found really interesting.
Yeah.
It mentioned that 2 patients were incidentally found to have prostate cancer during the HoLEP procedure,
That's a really important point. It shows that even when doing surgery for BPH,
which is benign.
yes, you can sometimes find other things.
So it's like going in to fix a leaky faucet and finding a bigger plumbing issue.
Uh-huh. That's a great way to put it. It shows the need for those thorough preoperative evaluations.
And open communication.
Yes, always.
I feel like communication's a big theme here.
It is. It's the foundation of good medical care.
Well said. Now, I know we've been focused on the technical stuff and the trainees, but I
Mhm.
want to talk more about the patient experience.
Okay.
What might a patient expect after going through this procedure?
Well, it's important to remember every patient is different.
Right,
So recovery times can vary.
of course.
But in general, HoLEP is considered minimally invasive,
Okay.
with a relatively faster recovery than open surgery.
So that's good news for patients.
It is.
But what about like those first few days or weeks?
Yeah.
What should they be prepared for?
Well, some common postoperative things are blood in the urine for a few days, some mild discomfort or burning during urination, but these usually go away pretty quickly.
So it's not a walk in the park, but it's manageable.
Exactly.
And what about those long-term outcomes we talked about? The
Mhm.
improved urinary flow and continence. How long does it take for those to really kick in?
Most patients start to see improvement in just a few weeks after surgery,
Oh, wow.
but it can take several months to see the full effects.
Because the prostate is still healing.
Right. It continues to heal and shrink. And remember those objective measures we discussed?
The IPSS.
Yes, IPSS, PVR, QMAX.
Right?
They usually show improvement at 3 months, and then it keeps getting better.
Okay, so it's a gradual process,
It is.
but it seems like it's worth the wait.
I think so.
Now, earlier you mentioned M-block HoLEP being more advanced.
Yeah.
Are there any special skills needed to do that?
Oh, definitely. Especially on very large prostates.
What kind of things?
Well, it involves dissecting the adenoma as one piece.
Right.
So it requires a lot of attention to those anatomical landmarks
Uh-huh.
and a very good understanding of the laser.
So it's more than just knowing how to use a laser.
It is. It's about really knowing the anatomy and having a steady hand.
Right. It's the knowledge, the skill, the experience.
Exactly. And that's why training and mentorship are so crucial.
We've come full circle back to training.
We have.
This study really highlights how important that is.
It really does.
Yeah.
It shows how committed academic centers are to training new urologists.
And it's reassuring for patients.
Absolutely.
Now, I know we've been talking a lot about HoLEP.
Yeah.
Are there any other treatment options for these big prostates?
There are. HoLEP is very effective, but it's not the only option.
What does it say?
Well, it depends on several things. The size of the prostate,
All right.
the patient's overall health, and their personal preferences. Some other options include open prostatectomy.
Which is...
It's more invasive.
Okay.
And then there's transurethral resection of the prostate, or 2RP.
Okay.
It's minimally invasive, but it might not be as good for really big prostates.
I see.
And there are always medications.
But those don't shrink the prostate.
No, they just manage the symptoms.
So it sounds like HoLEP has that advantage.
It does. It's minimally invasive, but it can remove a lot of tissue.
Right. And research is always moving forward.
It is.
So we're seeing new developments all the time.
Absolutely.
What are some of the exciting things on the horizon for BPH treatment?
Well, there's a lot of interest in new minimally invasive techniques.
Even less invasive.
Exactly. With faster recovery times.
So less downtime and fewer complications.
That's the goal.
That's great. And anything else?
Well, there's also research into targeted drug delivery,
What is that?
basically delivering medication right to the prostate.
So more effective and fewer side effects.
Exactly.
So you're saying we might be able to just give an injection or a pill?
Potentially, yes.
That would be amazing. And what about stem cell therapy?
That's still very early in the research.
Okay.
But the idea is to use stem cells to actually regenerate healthy prostate tissue.
Wow. So no surgery at all.
That's the hope.
Eh.
Sounds futuristic, but it shows how fast medicine is advancing.
Yeah, it really does. It's exciting to think about these innovations.
It is.
And how they can help men with BPH.
It's a really interesting time to be working in this field.
Now, as we're wrapping up this deep dive,
Uh-huh.
I want to go back to patient empowerment.
Yes, patients should ask questions. do their research, and really be their own advocate.
So for someone who's just been diagnosed with BPH, especially if it's a very large prostate,
Right.
what advice would you give them?
The most important thing is to find a urologist that you trust,
Okay.
someone who will answer all your questions.
And you feel comfortable with?
Exactly. Don't be afraid to ask about their experience with HOLEP.
Especially for large prostates.
Yes. Ask about the on-block technique.
And ask about trainees.
Yes.
Be informed.
So be an active participant in your healthcare.
Exactly. The more you know, the better decisions you can make.
So do your research.
That's the question.
And then don't settle.
Don't settle. It's your health.
Right. It's all about being an informed patient.
Exactly. And remember, even though BPH can be a challenge,
Right.
there are effective treatment options out there.
And with all this new research,
Uh-huh.
the future looks bright.
It does.
This has been fascinating.
It has.
I feel like we've covered so much.
We have, from the details of HOLEP to
Even stem cell therapy.
the future.
Yeah. But before we wrap up, I want to leave our listeners with something to think about.
Okay.
This study that we've been looking at,
Yeah.
it was in a very specific environment
Right. An academic setting.
with trainees.
Uh,
But what about people who aren't going to an academic center?
that's a good question. Healthcare isn't the same everywhere,
Right.
and the expertise can vary quite a bit. So it's not just about finding a urologist.
It's about finding one with specific experience
With HOLEP,
with HOLEP for large prostates.
because that experience can affect a lot of things.
It can. It can affect their technique, the equipment they use, even the post-operative care.
So what should someone look for when they're trying to find a surgeon for this?
Don't be afraid to ask a lot of questions.
Like what?
Well, when you meet with a surgeon, ask about their experience with HOLEP for large prostates specifically.
Okay.
How many have they done? Are they comfortable with the on-block technique? What kind of results have they seen?
So it's not just about qualifications.
It's about finding the right fit.
And if you're not getting the answers you need,
Get a second opinion.
absolutely.
It's your health.
You deserve to feel confident in your care.
So advocate for yourself. Be an informed patient.
Exactly.
I think that's a great place to end our deep dive into HOLEP for very large prostates.
It has been a pleasure talking about this with you and with our listeners. I hope everyone learned something new today about urology and about all the exciting things happening in the field.
I hope so too.
Until next time, stay curious, stay informed, and thanks for taking the deep dive with us.
Thanks, everyone.